So let's talk about recovery. You were saying you're up and walking already. When did that happen? How
Right,
has been
okay. Well,
pain from there?
they do have a very, very good recuperation, rehabilitation program here. And I've been under their care. The physios here on staff twice a day. I was given exercises to do. They come and help you do the exercises, and then we go for a walk, which I started again on a Zimmer frame, and very, very slowly walking, and they take it really, really slowly, which is good for me, good for my, I suppose, my confidence, to build my confidence up.
Yeah.
But if anyone knows me, I'm a bit like a bull at a gate. So I like to get going as soon as I can. So I'm now, after only 4 days, I'm just using a cane and moving, reasonably well. And this morning we tried with my physio walking upstairs, because when I get back to my home in Phuket, I'll be walking upstairs. So yeah, I'm feeling pretty confident, and I believe that it takes probably about a couple of months, 2 to 3 months, before you're fully back to normal.
And any pain now at all when you're walking? Is it sore?
No,
or just,
it's not too sore at all.
Yeah.
There is still a little bit of inflammation in my leg as a result of the operations, because all the muscles have to be moved out of the way. And I won't go into what they do because I don't want to even know myself. But yeah, it's something where they move a lot of muscles have to be moved to get to where they need to remove the bone that's in there and replace it with the synthetic materials.
And when will you be fully recovered? Do you know roughly?
Well, I'm hoping it's as quickly as possible, but maybe a month's time. At the end of February, which is now maybe 5 weeks away, I'll be going back to Sydney, and still taking it easy, and I don't get on my boat and start sailing again, because my plan is to ultimately bring the boat back up here to Thailand. So and that won't take place until middle of the year. So I'll be fully recovered by that time. Awesome. Yeah. So I can move around. So.
And what about checkups? You're going to stay in Bangkok till
and then no, I just have to see one doctor. I just go and see a doctor in Phuket. He'll take another look at the wound. They're I don't know the terminology that's used, self-emulsifying or whatever, but the stitches just disappear themselves. Yeah. So I don't have to worry about that aspect of it. So yeah, it's not a lot of follow-up has to be done. I mean, obviously, if I think that there is a problem in any way, shape or form, I'll go back to the doctors that they've recommended and referred me to, because there is a chain, and there is a Bangkok Phuket hospital within this chain. So yeah.
So this was diagnosed in Australia. And then
yes.
you just sent over all your doctor's notes from there. Did you talk to your doctors in Australia about coming to Thailand, or?
Yes, I did tell them. They said, "What are you going over there for?" And basically, I said, "Well, look, I can get it done a lot cheaper." They all agreed with me. But yeah, I did a lot of research and on both, and I told them about it, and they're more willing, very willing to help in any way. I brought across all my scans, both in hard form, X-rays, and what's the other one?
Like a digital.
Yeah, the digital scans.
Yeah.
The MRI scans, and the electronic, like on a CD. Brought all that across, which they used, and then of course they did a couple of X-rays themselves, and. And especially seeing as I'd had the heart problem before, I had to do a couple of scans for that as well. Electrocardiograph and an ECG had to be done. Yeah. So, which I would anticipate anyway. Yeah. So I knew that was coming.